All right, so we'll go ahead and get started. And as people join us, they can pipe in. So welcome to today's session. So this is the final session because the exam period opens, I believe, as of next week. So for those of you who are taking it, I do wish you the best of luck. Yeah, I'm sure you will all do well. I wish you well. So today's topic is actually applied expertise, evaluating what to evaluate, and advising and what to advise. So first, again, for those of you who are new on today's, this is your first chat. Basically, we will take a few minutes to just quickly. Okay. Oh, okay, so sorry, there was already a question. The document of the FDA, GLPs, OECD, and EPA. And thank you, Nicole, for sharing that. So for those of you, you might want to check out the chat. If you didn't already have that document, it really is a great document that just kind of highlights the differences amongst the three regulations. And it can just help with subtle differences. So you have a little bit better understanding, when you're looking at a question, if it's, EPA or FDA or OECD, the better approach. All right, so we'll quickly take a few minutes. Oh, sorry. My name's Shirley Dawson. I work from Charles River. I am a RQAP-GLP registered individual. I wrote it for the first time in 2001. I passed. And then I rewrote in 2005 because I didn't earn enough credits. And I passed that one again. So I've been RQAP for quite a number of years. And so it has been a number of years since I've taken the exam. But truly, other than the material augmenting, and 2005 was actually, I think, the first year that they included OECD. So I feel your all pain. The first time I wrote, it was only FDA, and now it includes OECD as well. So, but we'll quickly go through some logistics now. Just a reminder before we jump into it, this is a study group session. It's not a training. I'm not here to tell you answers to things. I'm not an expert in anything particularly, but the goal of this is to offer you an opportunity to discuss things. So we will have some questions that we can all work on together and kind of like see where everyone's minds go and then discuss it further. It's just an ability to, test yourself how much you know the regs, or identify if there's any areas that you're not so familiar with, to know, okay, I might need to study a little bit more on that. All right, so some logistics. I'll try not to take too much time on this, but again, the quiz is 165 multiple choice questions. 15 of those are not scored. The 15, we do not know which of the 15 are. So it's any random 15. Obviously the test people do know which one it is. Those non-scored questions are in there basically to test out the question as it may become a quiz, scored question in future. You get 3.5 hours to write the exam, and which gives you about 1.25 minutes per question. For extra cost, there is special testing for candidates whom English is not their first language. If English is not your first language, I do recommend that you do take that option, simply because you're going to see some of the questions are quite lengthy, and if you are trying to have to convert that into your mother tongue, you might waste some of the very precious time that you have in the exam trying to understand it. So the practice exam is now free, so we do encourage you to take it. Feedback on it is that it's much easier than the actual exam. That's why it's now free. But we do encourage you to take it because it's just an opportunity for you to get a little bit of practice of test taking and just kind of get a sense of, like, not necessarily the complexity of the questions, but it'll give you an opportunity to see how much text is in them and see how, some of them can be quite wordy. So you'll know, like, oh, okay, that's a problem, or that I know well, or that was a quick answer. The exam covers the FDA GLPs, the EPA GLPs, OECD principles of GLP, and 21 CFR Part 11. So helpful hints. So read through all the suggested material in the candidate handbook. There's a lot of references that for you to use as study material. So definitely use those. Know the regulations. Preambles will help understand the expected interpretation, and that's the biggest goal. When you're answering the questions, base it on the most conservative approach from what the regulations indicate. And it may differ from what you do at your company. Not to say that your company is not compliant, but think of like everyone always knows that one person who's like doesn't see any side of gray, it's either black or white. Well, approach the exam that way. It's only this way. There's only one right answer. So there's a lot of questions and not a lot of time. So read through the question carefully. If a question looks really long or complicated, you can skip it and come back to it. You actually have the ability to flag it while you're doing the quiz, so you can come back if you have extra time. The same as if you answer the question, but you're not 100% sure, flag it and come back to it. You don't want to waste 5 minutes on one question, because remember, you only get about 1.25 minutes per question. So you don't want to waste 5-10 minutes hovering over one question. So watch your time. After the first hour, you should be through about 50 to 55 of the questions. So pace yourself. If unsure, guess. A wrong answer is the same as no answer. So you're not penalized losing extra points if you get it wrong. A no answer is the same as a wrong answer. So if you get to the end and you got 3 questions and you're like, I'm not sure, just guess. Watch for keywords. These will help assess what regulations you should be answering. So protocol usually represents FDA and EPA versus study plan, which is OECD. Control article is FDA versus reference article, which is EPA, which is versus reference item, which is OECD. Reference to pesticides, that's going to be EPA. Multi-site, that's going to be OECD. And apply logic. Most questions typically have 2 answers that are clearly incorrect. And then the other 2, you might hem and haw going. Some of them it'll be easy, yes, the obvious answer. And then some you're like, it could be this or it could be that. So just look for key words, or, the protocol said this. And they're like, oh, let's just amend it. Well, if it was after the fact, we can't just amend, right? So those kind of things. All right, so applied expertise, evaluating what to evaluate, advising what to advise on. So I'm not going to read through all of the content, but I'm just going to sort of summarize what the content of those sections of the exam are. So for the evaluating and what to evaluate, that includes, so I just need to move that out of the way. Facility, operations, management, quality systems, contract labs, protocols and SOPs, QA systems, corrective actions, organizational structure, training records, and training program. And all of those topics represent 10% of the exam. Then we move into advising and what to advise on. These include applying the GLPs to studies to your company. Sorry, applying GLPs to studies and to your company. Study director management responsibilities, compliance statements, quality assurance statements and final reports, conduct during regulatory inspections, responsibilities when hosting inspectors, regulatory trends, training, compliance issues, QA findings, validation and equipment qualification, the quality assurance unit program, GLP documentation, content of training records, deviation documentation requirements, SOP content and distribution, report content and approvals, documentation procedures, corrective actions, post-inspection or audit, continuous process improvements, and archiving. And all of that, advising what to advise on, represents 18% of the exam. All right, so now let's get into some Q&A. So again, I've drafted a few questions, and we're just you can just put your comments in the chat, and from the chat we can go ahead and see what everyone thinks on these questions. So many of these questions are multiple questions at once. So what you can do for those is just basically, you can answer one question as like answer the first question, go to the next question, and so on, versus typing a large paragraph. It's truly up to you. Sorry, I was just going fast just to cover the initial information. Because those of you who attended the reminders about how to write the tests and stuff like that, what the content is. If you go into your candidate handbook, it's all in there. This is nothing I've created. Actually, I can go ahead and minimize this for a sec. So if you go to SQA, and you go to education, RQAP, and if you scroll down, candidate resources. So there's the candidate handbook. If you open that, everything I just yammered through really quickly, it's all in there. So all the information about taking the test, so the number of questions, special exam accommodations, all that's in there. And then concerning the topics, sorry if I'm making you dizzy. So here we have the GLP content. So it's all there. It tells you here, compliance assessment is 43%, which is split amongst monitoring, inspecting, and auditing. Then you go to compliance management, which is 29%, scheduling, reporting, record keeping, and documentation. And then applied expertise, and those are the topics we're covering today. The 28%, evaluating the critical assessment of the evaluating, and then advising. Okay, so it's all there. So, and as Lydia said, that the PowerPoints will be posted in the team site as well. So you can view that. All right. So let's move it along and go to the, if I can find screen. There we go. All right, so let's go to the first question, and you can just put your comments in the chat. So first question, when a deviation occurs, whomever deviated or identified the deviation should advise the study director. Oops, sorry, that's the answer. Okay, sorry. Reading my notes, that's a little less helpful. All right, let's try again. When a deviation, whether SOP, protocol, study plan, or GLP occurs on the study, what needs to happen? Who is responsible for what action or actions? Any differences between FDA, EPA, and OECD? So I misspoke and already provided one part of the answer, but there's lots of parts. So you can go ahead and start putting what you think the answer is in the chat, or any parts you want to share. And one of the GLP RQAP faculty, Brendan, is on with us as well. So he will also be assisting in helping drive some of the discussions. All right, study director needs to be informed and a deviation written. Perfect. SD for acknowledge deviation and assess the impact. The study director notified, deviation report initiated with a description of the event and corrective action. SD has to assess impact. You need to complete a deviation report. Great. Are there, so we have a deviation needs to be done. Perfect. SD needs to be formed. SD needs to acknowledge deviation and assess impact. Are there any differences between FDA, EPA, and OECD? Perform a root cause analysis in CAPA. You can do that. It's not strictly driven by the GLP regulations, but that may be part of it. Should be reviewed. Again, that's good. It's not specifically a requirement of the GLPs. So again, when you're thinking of these questions, think of not what you guys do as you're at your facility. Think of, if this was a quiz question, what would you be looking for in those multiple choice answers? So they won't ask for a review of the deviation. They won't ask for a root cause analysis in CAPA because those are not explicitly required by the regulations. Not to say that it's wrong practice if you're doing it, but think specifically, what do the regulations require? So can anybody identify if their OECD language includes PI where necessary? Yep, so we've got PI, excellent. Okay, so we got a lot of great answers. So I will read you my response. So when a deviation occurs, Whomever deviated or identified the deviation should advise the study director. A deviation should be created which aptly identifies the deviation. Study director has to authorize, which is FDA and EPA GLPs, or acknowledge, which is OECD terminology, the deviation. Those requirements come from 5881A, and that's FDA, or from OECD, it's 282B and 211.22E. Again, all of these, this PowerPoint presentation with all those notes will be posted after the class. So no worries about trying to immediately write everything. Study director must assess the impact of the study. Though contributing scientists may weigh in on the impact of the deviation on their work. For example, a PK scientist may help assess deviations of TK samples being collected. If the deviation occurs at a test site, the PI would be responsible for assessing the impact on their phase, but the study director still has the overall responsibility for impact assessment on the overall study. Deviations impacting the study, protocol, study plan, GLP, and potentially some SOPs need to be included in the report. And that's a requirement from 58.185A8 of the FDA GLPs or 299.2 of the OECD. And QA is responsible to ensure that no deviation from protocol or SOP occurred without proper authorization and documentation. That comes from FDA and EPA, 58.35B5. And under OECD, the study director is actually responsible to ensure deviations are addressed. And that comes from 1.22E. So there is a subtle difference between OECD and FDA. FDA, EPA, QA is responsible to ensure that the deviation's been addressed. And under OECD, it's study director's responsibility. So that's for those of you who work in the FDA world, if you've ever been audited by the FDA, you may have had a QA citation for a deviation that wasn't addressed. And that's just, would you be able to show the written answer and read it? Yes, everything I just read was the answer, and the PowerPoint with all that. Oh, to show unfortunately, I don't have the answer on a PowerPoint. It's only in the note section, so unfortunately, I can't do that. But as I said, the PowerPoint, this specific presentation with all the notes will be posted after this meeting into the team site, so you can access it there.
Sherry, if it's convenient for you, you could always copy and paste it into the notes, into the chat.
Okay. Sure, yes, I can do that. All right, let me just change it so it's not just going to send it to you, Lydia. Okay, so I'll do that. It's a long one. I don't know if it's going to let me do that.
It might ask you to break it up into sections.
No, it's not even that. It's not. I don't know if it's copying and.
Oh, I see.
No, when I'm pasting, it's only giving you the YouTube link. Okay, so what I can do actually is I can take it out of this one. There we go. Well, it's too long. All right, there it is. So I shall lower this. Okay, so I'll go back and forth between presenter mode and otherwise, so that way I can read it appropriately, and then I'll post it once you all have had a chance to answer. All right, are there any questions before we jump into the next question? Again, the more you ask, if you're unsure of stuff, the more you're going to learn. So don't be shy. It's a safe space here. There's no judgment whatsoever. And again, most of you who are answering a lot, not that you've said anything incorrect, But I will point out when something is just, that may just be your site, your company's practice versus what's strictly required by the regs, because that's just how you have to think of it for the exam. I'm not here to tell you what you do at your company is right or wrong. I'm here to say it's not specifically stated in the regs. So, you know, that works well, but you may not see that as part of the answer. Okay. All right, so let's go to question 2. The study director reaches out to you as the auditor for their study, as the sponsor has decided that they would like to take some samples of the liver at necropsy for exploratory analysis. The sponsor claims that the work would be outside the scope of the study. The study director is not certain what to do. Can they amend the protocol to add these samples to be taken? Are there other considerations? Are there differences between an FDA study and an OECD study? All right. And if these are situations you've never come across at your facility, that's okay. Just put in your best guess. As I said, this is a safe space. I'm not here calling people out going, well, you have the wrong answer. That's not what we're here for. We're here to learn and learn from each other. So the first question, can the protocol or study plan be amended to add these additional samples? We've got a yes, amend the protocol. Awesome. The taking of additional samples should be first listed in a study plan amendment before taking it. Absolutely. Yes, it should be amended. So protocol amendment can add collection of samples, but handling and receipt documentation would need to be included in the study records. This includes which study the samples are being transferred to. Yes, yes, amend. All right, so we got a lot of yeses. So that is correct. Yes, you can amend the protocol or study plan to take those samples. And absolutely, as someone had indicated, you need to do that amendment before you go and collect the samples. All right, can be amended, but samples are always GLP specimens and any findings need to be relayed back to the site director. All right. Yes, that is true. It's part of a GLP study. Add the exploratory analysis in the compliance. Yes, absolutely. Sometimes they will take samples and they're not analyzing specifically for a GLP component. They may be taking samples so that they can test stability for another study that they want to take samples in. They may be taking samples to elaborate on characterization of the drug or something like that. There's all kinds of different reasons they may take these samples, and especially in the current world where we want to reduce the number of animals we're using. So often sponsors do want to say, well, you know, take some blood samples for us because we're going to extend our stability. Or can we have, you know, once you take your samples for the liver, take an additional sample so that we can do some assessments. Study director will add to the amendment if the results affect the results of the study, then those results will need to be shared with the study director and may be reported. Then if any impact of results on study, even outside studies, should be communicated to the study director. So yeah, so of course you're going to amend the protocol or study plan, include all the details of taking the samples. You're going to document all those processes as you're doing them, right? The same, it doesn't mean just because it's a non-samples for exploratory work, it doesn't mean that we don't document that samples are being taken. Sorry, I'm speaking really fast. I will slow down. My coffee's kicking in. I had a coffee at lunchtime, so I will try and slow down a little bit. Sorry. But yeah, so you're going to document, as you guys all said. So is there anything are there any other specific considerations? So you all did, or several of you did indicate that the study director, because they're the single point of study control, they need to be aware of sort of the outcome, right? So if they're using those samples and come across something, they need to communicate that back to the study director so the study director is aware, because they're the single point of study control. Are there differences with OECD? Do we have any OECD folks out in the audience? Probably. There is. Communication of results back to the study director should be addressed in the amendment. Yes, absolutely. Okay, so we have some great feedback from here. Again, during the exam, this is all multiple choice. So you're not gonna have to try and sit there and think of every case imaginable. You're gonna look at the options and it'll be very clear. Two of them are like really not it at all. And then the other two, read them carefully and you'll see, oh yeah, look, that says amendment and this one just says to go ahead and do it. Oh, we know we need to amend the protocol. We can't just magically take samples. That's the right answer. Okay, so I will go ahead and copy that in. And even that doesn't include everything. All right, so the study director can amend the protocol or study plan to take these samples. However, there are specific requirements. The analysis needs to be reported back to the study director. The study director will need to include the analysis in the study report, even if to state that the work done was conducted and had no impact on the outcome of the study, as the work was done for whatever reason. Example, used to help validate long-term stability for liver samples to be used in other studies. Study director is the single point of control for the study, which comes from 58.33 of the FDA GLPs. Yes, there are differences with OECD. Under OECD, if the analysis is outside the scope of the study, the analysis does not need to be reported under the study. The study director must indicate that the samples were collected and sent to the sponsor and state that the sampling and handling was out of scope of the GLP study. OECD 21 position paper regarding possible influence of sponsors on conclusions of GLP studies is the source of that. So it is a little bit different. They don't actually have to go back and include that information. So that's one of those interesting differences. And that sort of ties in with how OECD treats a study versus how FDA treats it. All right, are there any questions on that? I will throw in one more aspect to that. What about archiving? Are there any special archiving requirements for those samples and stuff? If you're part of the GLP specialty section, you may have come across questions like that. And typically the response is that if the samples are taken for exploratory work or taken for possible future work, those samples need to be archived before the study finalizes, and the study director needs to be advised that they're archived. They can't just have samples floating around, because then things could get lost or no longer communicated back to the study director. Yes, archiving should be addressed in the amendment. That is correct, Diana. All right. Any questions on this one? All right, so we'll go to the next question and I'll give you a few minutes for that. So a sponsor hires a contract research organization, CRO, to run a GLP study in accordance with OECD test facility. They advise that another CRO will act as a test site and conduct the bioanalysis and toxicokinetic analysis for the study. What is the test facility expected to do concerning assessment of this test site? What role do others play for multi-site studies? So I'll give you a couple minutes to think that over and add a response. Okay, so test sites should be qualified. They should make sure that any additional test sites are GLP certified if in Europe, or qualified as a GLP certificate, EIR, or any GLP from their monitoring authority. Okay. Qualified PI, yeah, absolutely. All right. And what roles are there in multi-site, and what do they have? What are the different roles? Assignment of PI from the OECD. Yep. PI, which is the principal investigator. So the principal investigator, test site management. Absolutely. Okay. So I'll go ahead and read the response and then copy and paste it into the chat. That quality assurance program. Yep. You want to make sure there's a LQAP is there. All right, so the test facility CRO is responsible for ensuring that an appropriate principal investigator, or PI, is assigned to the phase and ensure clear lines of communication. That comes from 2.1, 1.22, H and O respectively in the OECD. Under OECD, guidance 13, so that's a key one that you actually want to make sure you do review, because that's on multi-site, and there's a lot of work being done with multi-site. So it's highly possible that you may come across questions on multi-site. So OECD 13, test facility management. They should approve selection of the test site, ensure lead QA is designated, ensure open lines of communication exist. Test site management ensures adequate resources, assign and replace as necessary, and appropriate PI. The study director ensure that the study plan is made available to the test site, include appropriate information for test site work in the study plan, communicate with the PI, incorporate PI's contribution into the final report. The PI acts on behalf of the study director at the test site, ensures deviations are communicated to the study director, provides a contribution for inclusion into the final report, including a statement confirming GLP compliance of the work. Ensure that all data, materials are transferred to the study director or archived as described in the study plan. Lead QA should liaise with the test site QA, ensure study plan is verified, and final report is inspected for compliance with GLP, including contribution from the PI. Test site QA maintains a copy of the study plan and amendments, inspect according to their procedures, report audits to the PI, test site management, study director, and test facility management, and lead QA, inspect PI's contributions, and provide a QA statement for their activities. So lots of different functionalities there for everyone involved in a multi-site study. Oh, okay, it's a little bit long. Okay. Is there any questions, or anybody has anything to add on that for the multi-site? Nope. So we shall move on then. All right. Again, they're very long situations. Not all the quiz questions, exam questions will be that long. Some of them will be shorter. Some of them will be as long. So, but again, it's all multiple choice. So you don't need to sit and write a paragraph to address everything. All right. A pesticide field trial is being conducted, and the test substance is received in 3 large trucks as it is sprayed into the designated fields. The study director reaches out to ask you, as the QA auditor for the study, if they're required to keep storage container, which are 3 large trucks. What do you advise based on the regulations? Are there other actions that can occur? So I guess first question is, what regulations are we looking at this point? EPA. All right. Yes. So yes, EPA. Perfect. And we already have an answer. All storage containers must be retained, but an exception can be requested from the EPA. Great job, Nicole. So Nicole's been clearly studying her EPA. So absolutely. so this one was a fairly easy one. It's still a long because does anybody else have anything else that they want to add? So I will go ahead and I think I'm just going to go ahead and copy and paste this answer. So the answer is yes. So it's under EPA. The answer is yes, they need to maintain the storage containers. Sorry, everything needs to be pasted in 2 bunches. But under EPA, when you have unique scenarios of what the storage container is, so in this case, 3 large trucks, you definitely don't want to have to keep those, especially like what if the study's like 2 years long? Who is space to retain 3 trucks for 2 years? So you can actually submit to the agency and request a waiver involving large numbers of containers or safety concerns made to the director. And so that is all coming from 40 CFR 160.105. But this came from the specific information. So you can request, and I'm not going to read through all of that, but special requests can be made. And then it has the requirements of what you need to put in that request. So you should identify any special storage burdens or safety hazards. EPA will request sufficient documentation. So you can't just say, I have 3 trucks I don't want to store. You actually have to show proof, documentation to show what the test material was delivered in, and maintain proper records of everything, of containers have been used and stored and thoroughly accounted for, etc. Okay. Right, great job on that one. All right, let's jump into number 5. A lab scientist at a contract research organization, CRO, in the US reaches out to their QA group. A sponsor from the UK wants the CRO to run a bioanalytical method validation GLP. The lab scientists indicate that they cannot make a full claim to FDA GLPs. The sponsor does not understand, as another CRO in Canada completed a different bioanalytical method validation to GLP. Is the lab scientist correct? Is the sponsor correct? Why or why not? What would you advise if you were QA? So again, you can break them down as questions. So is the lab scientist correct? Yes or no? Who thinks the lab scientist is correct? Method validations are not GLP studies. However, they should be performed according to GLPs, as it will support GLP studies. The lab scientist may validate to FDA GLPs, but this data may not be valid in the UK. Yes, correct, since even no claim for GLP is required, but under request could still be done as GLP. Okay. So is the lab scientist in the US correct? What about, let's do a show of hands. Who thinks? So Madison has a great question. Was the Canadian CRO claiming FDA GLP or OECD GLP compliance? So that's a great question. In Canada, if you're running GLP work that falls within scope, you need to have your OECD GLP certificate to claim compliance. So if you're in Canada, you should be OECD. Yes, FDA and OECD accept each other, absolutely. So we have no, not correct. So the US lab scientist is not correct. Okay, does anybody else think they are or aren't? Okay, what about the sponsors? The sponsor correct? Is the sponsor just making something up when they said the CRO in Canada ran a study full GLP? You can run BA method validation GLP, but you don't have to. Just so again, some of these answers are coming from your site's practices, which is great, but go back specifically to what the regulations say. Doesn't meet definition of non-clinical study, no test article applied to test system. However, can adhere to GLP regulations where they are applicable. Great. That's a great answer, Jen. Thank you. Sponsor is correct. Okay. All right, so I'm going to go ahead and read the answer just to put you all out of your misery. Now, if this one was a really tough one, especially if you know, most people only work within one set of regulations in one country. So this is a neat question because it covers different locations, right? So the sponsor is from UK, so they're following OECD GLPs. The US are following FDA GLPs, and the CRO that was in Canada is following OECD. So we've got 2 OECDs and 1 FDA. So first, the lab scientist is correct. So as Jen pointed out for us, as per FDA GLP regulations, a non-clinical laboratory study means in vivo or in vitro experiments in which test articles are studied prospectively in test systems under laboratory conditions to determine their safety. And that comes from 21 CFR part 58.3. So the drug needs to be studied in a test system. So validating a bioanalytical method does not meet the definition of test article in test systems. So the lab scientist is correct that they cannot make a full GLP compliant claim. So they didn't say they can't follow the GLPs, but they said they can't make a full claim. The sponsor is correct, though. As per OECD principles of GLP, non-clinical health and environmental safety study, henceforth referred to, sorry. So what happens when you talk for an hour? You lose your voice a little bit. So non-clinical health and environmental safety study, henceforth referred to simply as study, means an experiment or set of experiments in which a test item is examined under laboratory conditions or is in the environment to obtain data on its properties and or its safety, intended for submission to appropriate regulatory authorities. And that comes from section 1.2.3.1. So under OECD, there's no requirement for the test item to be administered or tested in the test system. So the study may be run fully compliant to OECD principles of GLP. So the sponsor is correct that CRO probably did follow and make a full GLP claim. As the other CRO, the sponsor refers to is in Canada, which follows OECD, the sponsor was correct. So far, both people are correct. So now, since you're the QA person in US, as QA, you would recommend the lab scientist explain the difference between what studies fall within scope in the US versus OECD. So you can say that we can follow the regulations, but we can't make a full claim of GLP because in the US, a validation doesn't fall within scope of what is a GLP study. All right, so that was a big complicated one. And that's kind of the point. If you can get through these ones, hopefully you should do really well on the exam. All right, let's see if it's gonna let me post it all over. Nope. Okay. Does anybody have any questions on that? Okay. Oh, we do actually have a. What would the compliance statement say for the validation in the US? So that's a great question. Thank you for asking that. I have seen, and we've done it in the past. Now, at my company, we no longer claim compliance. But typically they, when we did that in the past, we would say that the study, sorry. The study was run according to applicable sections of the GLP regulations. So we would follow it with the sense of it, but it's not a GLP study. So we're just making claim that we follow, that we're going to do, there's going to be a protocol, that we're going to have proper documentation standards. There's going to be SOPs. It's going to explain all out what we're going to do, but because it doesn't fall within scope, that's what our compliance statement said. And I'm sure if you ask different companies, they have slightly different wording, but essentially it makes a claim that we're going to follow the regulations, but it's not within scope of the regulations. All right. I think this is my last question. Again, another really long one. On a GLP study, the dose formulation analysis is conducted at another facility from the testing facility. This location, there was a non-study specific deviation issued for freezers, as the temperature was not monitored for 24 hours. One of those freezers housed the dose formulation samples for the GLP study. The contributing scientist at the other company assessed impact on the samples from that non-study specific deviation and included it in the study data package. QA at the other facility conducted the audit of the phase, and the phase was finalized. This deviation was not included in the phase report, as the contributing scientist deemed the freezer issue did not impact the samples. Are the actions appropriate? Should the contributing scientist or QA have done something else? So I'll give you a few minutes to read through that and really absorb the question. Okay, so to point out a few things. Did the deviation occur before or after analysis? We will say before analysis. The deviation report should be included since it documents the non-impact. The storage is a requirement for the study plan, and the storage affects the stability. This should be added to the phase report. Since you said contributing scientist and not PI, I'm guessing this is FDA, so the study director should have assessed the impact. All right, good job, Stephanie. You picked up on that. So this one is worded very awkwardly because you'll see that there's no reference to test site or PI. Because this is coming from, this is your big indicator that Stephanie picked up on. Yes, this is FDA. So it's testing facility, not test facility. So that's a big indicator. There was no reference to a PI. There was a reference to the contributing scientist. These are all terms that are signifying FDA or EPA. So that's your first ticket. I didn't want to confuse it by adding test site and PI. Now, most FDA facilities start using that. Again, US is part of the OECD, and as you can see by reading this question, it's a little bit more easy to understand when you say test site versus other facility and the other facility. And it's easy to identify PI versus contributing scientist and stuff like that. Contributing scientists can assess impact from their perspective, but needs to be relayed to the study director for overall study impact. QA should have ensured no deviations occurred without proper authorization, which means it should have been included and SD informed. Ding, 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 ding. So that was absolutely right. So all of you putting your responses in there, you're all completely on the right track. So were the actions appropriate? No, the actions were not fully appropriate. They were partly correct, right? We didn't just ignore that the freezer was out of whack. We didn't just pretend the deviation didn't exist at all. The contributing scientist had the deviation, they assessed it, whether they felt it impacted their work, but it's FDA, who's the single point of control, regardless if it's FDA, EPA, or OECD, single point of control is the study director. So this essentially becomes an SOP deviation. We'll even say it's an SOP deviation, not necessarily a protocol deviation. The study director still has to assess that. Because it's an SOP deviation, it doesn't necessarily have to go into the report, but the deviation absolutely needed to be sent to the study director for overall study impact. So QA should have cited the fact the deviation did not have the study director impact and should have been forwarded on. Again, under FDA, who's responsible for ensuring deviations are addressed? That's QA under FDA. And the QA statement and contributing report should not have been signed until the study director weighed in on the deviation. So you all got that. That's a great answers from you all. Despite a very long question, it was actually quite a short answer. All right, does anybody have any questions on that question? Okay. Are there any questions on anything in general? So we're kind of at the last 5 minutes of the session. So I want to open the floor if there's anybody has any questions or comments or any advice they're looking for, raise it now. If not, we maybe have time for one practice test question. This one it will be multiple choice. If you guys want to do that, we can tackle one. Again, these are coming directly from that practice quiz that's available online that I do encourage you all to take. Again, it's just a practice. It's just to get back in the habit of taking the exam. And as they say, the quiz questions are easier than what ends up in the exam. So maybe pressure yourself to do it in less time. So there's 30 questions on that practice. Give yourself like, so give yourself like maybe 20 minutes to try and see if you can do it. All right. So let's try the first one. So you are the new QA manager at a small laboratory. In the course of a facility record review, you cannot find any job descriptions, and it is likely that none have ever existed. You should notify management that no job descriptions exist, ask study directors for historical job description information, recommend that job descriptions be written quickly, document in every data package that no job descriptions exist. What your options are 1 and 2, 1 and 3, 2 and 4, and 3 and 4. So. Okay, we've got a 1, we've got a 2, we've got a 1, we've got a 2. Okay, so I think based on the answer so far, everyone can absolutely say that out of the 4 options, notify management that no job descriptions exist. That is an absolute. So that's great. And I think we can safely remove document in every data package that no job descriptions exist. That's unreasonable to put in every single data package at the facility that no job descriptions exist. You're going to address the deviation, but get them done, right? All right, so let's go to the answer. And the answer is 1 and 3. So 2 is, while a good idea, ask the directors for historical job description information. That doesn't actually say that they're going to create a job description, and it's not just study directors who need a job description, right? Everybody requires that. So from OECD Principles of GLP, Section 2, 1.1, 2, C1, and CFR Part 58, 130E, test facility management responsibilities at a minimum include ensure the maintenance of a record of the qualifications, training, experience, and job description for each professional and technical individual. So that's the regulatory citation. So that's why number 1 was an absolutely yes. We know it's management's job to make sure there's training records. So that was the easy one. We know that this number 4 is not even realistic to document it. Why would you document that? You need to address it, but you're not going to put in every study record that you don't have job descriptions. So number 4 was an easy no. So that meant options 3 and 4 were immediately gone, and now you were left with 2 options. Or if you took the first class in terms of what type of test taker you are, you know number 1 is absolutely correct. So your options are 1 and 2. So that's a perfect example of how this works. There's going to be 1 or 2 that are absolutely no way, and then there's 1 or 2 that it could be this one or this one, and then read through it. Ask the study director for historical job description information. Okay, that's great for the information, but you're QA, right? You're not responsible to create a job description, but you're going to basically say job descriptions need to be created immediately. All right. We're at the top, but if you guys want to stick on for another couple more minutes, we can just tackle this last question. Four, 5, 6 requires testing to be conducted in compliance with 21 CFR Part 58 according to its protocol. Lab XYZ perform the pathology portion of study 4, 5, 6. Lab XYZ uses 1 procedure for processing, preparation of slides, and the procedure is repetitive in nature. The QA statement in the pathology report shows that a process-based inspection was performed to monitor GLP compliance during the conduct of the pathology portion of a study. With which of the following did the lab XYZ fail to comply? Select 1. Okay, I got a few answers. I got a few C's. Is there any that we can actually remove? So I think we can all conclude they failed to do something. So I think A is an easy removal. And then answer B, nothing as process-based inspections is valid. Well, we stipulated 21 CFR Part 58, and there's nothing in the FDA GLPs that discuss process-based inspections. There is an OECD, but not FDA. So that's another elimination. So now we're down to C and D. Amend the protocol to specify that quality assurance unit will do process-based inspections during the conduct of the pathology portion of the study. Well, so I don't know that that's applicable, because that's like saying we're not going to follow the rules, but it's now a rule because we put it in the protocol. You can't instruct non-compliance by putting it in your protocol. You can acknowledge that it's going to be non-compliant, but you can't instruct, oh, we're gonna ignore the part that requires QA to do critical phase audits. So those of you who said C, you are correct. And there's the regulatory citation from it. So 2158.35B3. Quality assurance unit shall inspect each non-clinical laboratory study at intervals adequate to assure the integrity of the study and maintain written and properly signed records of each periodic inspection showing the date of the inspection, the study inspected, the phase or segment of the study inspected, the person performing the inspection, findings and problems, actions recommended and taken to resolve existing problems, and any scheduled date for re-inspection. Any problems found during the course of inspection which are likely to affect study integrity shall be brought to the attention of the study director and management immediately. All right, so hopefully that gives you an idea of what the quiz questions are, exam questions are like. Sorry, I keep saying quiz, but exam questions are like. As I said, I do encourage you to check out the exam quiz. Okay. Go back to the candidate resources. So there is the practice exam is, oh, there we go. So the GLP practice exam. So from the SQA website, you can click on that, try it out. So we are past the time. I don't know if anybody has any last minute questions. If not, thank you all for those of you who've been coming to these study groups. Hopefully they've been helpful for you. Don't forget the material will be made available so you can go and check out and read through the slides as you want. And with that, I wish you well in your exam taking. There is a community in SQA Connect. So if you have any last minute questions, you can post in there and we will address your questions. So with that, I wish you good exam taking and quickly show how to access the practice exam. Sure. So I will take you all the way from the beginning again. So if you go to the SQA website, so sqa.org, and you don't even have to be a member, but you're going to go to under education and career. You're going to go to the RQAP credential. You can go straight to the candidate resources if you want, or you can just go straight to the page, but let's go to the candidate resources. And under the resources, it has your handbook. So if you open that, you get your handbook that covers all the logistics and the content that's in the exam, all the recommended readings, etc. There's a link to the study reference material, so you can click on that. And then we'll open a bunch of links, the different documents that are encouraged to be read for the exam. The exam content outline. You scroll down, so you've got the February slides. And if you scroll further, you've got the GLP practice exam. So you get 38 minutes to do 30 questions. So there has been feedback that they are easier than the exam. So maybe test yourself and give yourself like 20, try and do it in 25 minutes because exam questions might be a little bit more, a little longer or a little bit more complicated. So, you know, push yourself if these are slightly easier questions or, you know, do it the first time and then try it again. So it's there and you can just open it and I think it's pretty straightforward. I haven't actually. Yeah, so you can just add it to your cart and check out. Okay. So thank you all. Again, good luck and don't be shy to reach out through the SQA Connect if you have any questions or any concerns. That's it. All right. Thank you all so much for attending.